self-generated code as well as these components.
Yeah, and I always like to use the analogy about SBOMs just to kind of simplify it. Like if you go buy, let's say, a jar of canned tomatoes, or jar of canned tomatoes. It's either a jar or a can, I guess. A jar of tomatoes, or I usually use a frozen pizza. On the back of the frozen pizza is all the ingredients. So you know if you're allergic to one of the ingredients, like what makes up that pizza. And this is like that push for transparency. So if I'm a healthcare delivery organization and I want to buy a medical device, I know the third-party libraries that make up that device. So I have some, like this says here, transparency, and I can actually make a calculated decision based on risk. You still there, Trevor?
Oh, are we back there?
Yeah.
Yeah, I think my internet dropped for a second there.
Oh, no worries.
All right. I heard you starting where you were discussing an analogy around a jar of something. And so
I pivoted to a frozen pizza analogy.
A frozen pizza analogy. Yeah, that's a good one as well. It's a very similar effort for why food labeling was created at a certain point. And this is another type of labeling, is transparency and openness about what is going into a product. In this case, medical device. For food, it can be obviously whatever you're eating. Another one that I know you've mentioned in the past is like a car. You have the right to know what builds the car, what goes into the car, different components within it. And so this is really just an effort to provide more transparency and labeling to end users to see how they may be affected by making this decision to use this product. All right. Now, why does the FDA care about SBOMs? Like I said, SBOMs were originally created more for legal and licensing compliance. The FDA is focused on SBOMs for cybersecurity. So how did we get to this point here? Regulators want to see a shift left approach with cybersecurity in development with medical devices. What we mean when we say shift left is taking things earlier on in the design and development process. So we're building security into our product as opposed to trying to retrofit security on at the end once we finish developing it. SBOMs are a great way to do this. As you're developing your product, you're able to iteratively perform assessments on the risk profile of your system, identify any vulnerabilities or risks that you may be introducing into your system as you're generating early SBOMs, tracking them and monitoring them.
So now, are you saying that SBOMs are just a good practice in general when you're developing software from a risk perspective?
Definitely. And this isn't just specific to medical devices as well. SBOMs are commonplace within the automotive industry, industrial control and automation systems. You'll even see them in finance. You'll see them obviously within the legal use case, but you can look at a lot of very large software products as well. Slack was an example for a while. I'm not sure if they still currently have that, but you can look up their SBOM online and you'll see that publicly hosted just for anyone to access, which is the industry best practice there. But many different types of companies will use SBOMs, not just medical devices there.
Cool.
Now, ensuring compliance within an SBOM is a great way to enforce security, start to finish, and end-to-end solution. When we're tracking components, as soon as we integrate them into the system, we're able to see in real time what vulnerabilities we may introduce and how to appropriately fix them. It's also very important for the FDA that users of a medical device see what makes up the system. We were talking about some of the examples of why having proper labeling is going to be important. Users have the right to know what makes up the product that they're using, but it's very important for them to understand any risks associated with its use. It may be the case that users want to see what goes into the SBOM and they identify that there is an unsafe component being used in the medical device. They would then be taking on some risk by using that product, which is their right to know if they are taking on any risk. This is also great for the manufacturers to adhere to and proactively talk about any potential risks of using the product to avoid any situations coming up where users feel uninformed about potential risks in the system.
So this would be like if I have access to the SBOM and I'm a healthcare delivery organization, and I know that the medical device is vulnerable to Log4j, as an example, which is a third-party library. then I can make an informed decision if I'm going to put that device on my network. Is that kind of what we're saying here?
Exactly. If you didn't know that there were vulnerabilities already in the device, you may have just made the decision where otherwise you would have decided not to integrate it into your existing system. So this is a great way to help allow users and operators to make some more informed decisions about their products and about their health overall.
Yeah, because in the past, I know with like Log4j and Shell Shock, a lot of medical devices, nobody knew that they had those third-party libraries in there, so they're actually vulnerable, but the healthcare delivery organization did not know they were vulnerable because SBOMs weren't mandated back then.
Definitely. And even if you are looking at a situation where you're identifying it with an SBOM, SBOMs are a great solution for tracking down exactly where you are seeing that effect. It may be the case that you know that you're using Log4j within your system somewhere or another, but it can take hours to track it down, sifting through the code base and trying to identify where exactly you're integrating it into your system, especially if you're doing it through a transitive dependency, which is when a dependency is calling to another dependency. With an SBOM, it's going to point to you to exactly what dependencies are calling other ones, exactly how and where they're used in the code base. So the second you identify a vulnerability, you can quickly remediate it as you know exactly where the source came from. All right, now, when we're developing SBOMs, the FDA calls out to the NTIA minimum elements as how they want to see SBOMs structured. This is a list of components that would go into an SBOM, and for each of these will apply to every single component within the system. So this will be any third party as well as any first party dependencies. It can be a little bit trickier to get some of these for software that a manufacturer has written themselves as the OEM there. For an example, identifiers such as package URLs or common platform enumerators can be a little bit more tricky to associate with code that you've written yourself. However, the FDA still wants to see these minimum elements associated across full SBOMs. Now, each of these items originally did not come in specifically for the medical device industry. This is more of a overall standardized approach to SBOMs. However, these are going to be consistent across a wide variety of different industries. When we're looking at supplier name, this is pretty self-explanatory, effectively just whoever makes it. And then for that component, we want to see the name of it, the version. A unique identifier is generally going to be a unique string or a URL where we're able to locate that specific package. We want to see how it's included in the system, whether it's a dependency of another dependency or if it's directly integrated. We want to see who created the SBOM and then when the SBOM was created as well. Now, there are a couple of additional items that the FDA does look for as some supporting information here. They'll want to see for each component within the SBOM, the level of support, as well as the end of support date, if that has been published by the manufacturer. It's not always the case that that is readily available, but those are some additional bits of information that the FDA does like to see for each of these components. Now, these are not NTIA minimum elements, hence why they are not listed here, but these are some additional controls or some additional component elements that the FDA wants to see to prove some further security within the system.
And all this is supposed to be in machine readable format, which is often a challenge for some organizations.
Definitely. And there are a couple of different SBOM formats. I know we have a slide coming up here in a little bit talking about some of those different formats where we can dive in a bit deeper. But exactly like you said, the FDA wants to see this provided in a machine readable and a standardized format so that it's easy to integrate into existing systems and workflows. And speaking of, we'll talk about SBOM formatting. So like you were saying, they want to see this in a machine readable format. Some of the industry standards include SPDX and Cyclone DX. These are SPDX.
Maybe we should define what machine readable is, because when I have conversations with people about SBOMs, they're often confused what that means.
So typically that is going to mean the just type of file that it is. The standard approach and what is accepted by the FDA is a JSON or XML file, which those are generally going to be pretty difficult to read easily. Just sifting through it, if you were to open it like a regular file or a document, it won't be formatted in an easy to read fashion. Now, what these are great for is existing with integrated tools or other workflows that you have in place. You're able to build out workflows to process JSON and XML data much more easily than, say, a Word document or a PDF document, which would be a lot easier for humans to read. So when we're saying a machine readable format, they're typically talking about the format of the document. It's also very easy to modify JSON or XML SBOMs with some existing SBOM tools. The formats themselves are the standard, so SPDX and CycloneDX have toolkits where you can interact directly with SBOMs, make some changes, and that's very easy within a machine readable format. So that's part of the push for that requirement there.
It's kind of like HTML is kind of hard to read if you just look at the code, but a browser, which is a machine, basically can open it up and display it much easier.
Exactly. Yep. And with a lot of these, you're able to make it a bit more of a human readable format. We would generally recommend moving these from JSON or XML formatting and moving it into an Excel document, which it'll still be quite a big Excel table and a little bit tricky to read, but it's a lot cleaner than just trying to get everything, trying to sift through everything in its original format. Now, the two main industry standards for the actual format of the document, not so much the file format, is going to be SPDX and CycloneDX. SPDX is the ISO standard for SBOM formatting. That is the Software Package Data Exchange, and it is an older method for formatting SBOMs, and it originally comes from the licensing and legal compliance requirements. CycloneDX is a little bit more of a modern framework for SBOM management. It's very lightweight, so they're going to be a little bit smaller and a little bit easier to sift through than an SPDX SBOM. They are less focused on components and the legal compliance, so they're less leaning into the component relationships and indexing of different bits of code or different files within the system, which is a lot more common through SPDX. And they're instead focused largely on security efforts. So CycloneDX is a bit more geared towards security specific requests, but the SPDX format is a more standardized approach across a wide different range of industries and would be a little bit more common practice, especially for more mature industries where SBOMs are not as new of a requirement. Either one of these can be in JSON or XML formatting, and each format has its pros and cons, as we've discussed, though the FDA will accept either one. There isn't any huge preference towards one or the other. And what is most important is to have consistency within the submission. If you're preparing several different SBOMs, prepare them under a single format. If you are preparing multiple different components within an SBOM, make sure they are all structured the same way. The FDA is not going to want to see scattered SBOMs where there is no consistency or traceability between components. They want to make sure that everything is in a structured format.
Scattered SBOMs doesn't sound good.
It doesn't sound good. Scattered SBOMs is where they get you.
It sounds like a cluster bomb or something, like from a military term.
Yeah, exactly. All right, now talking about some of the other benefits of when we have an SBOM within our system and when we're properly integrating SBOMs into our workflows. One big thing and the main thing that we're really looking for is increased transparency into the product. We really want to understand what is going on inside of the device. We may even be able to identify transitive dependencies that the manufacturer wasn't aware of. This is a very common case when we're preparing first cuts of SBOMs, going through the source code to generate these files, is we may sift through and identify a bunch of components in place that the original manufacturer had no idea that had inadvertently worked their way into the system. This is just the way that third-party dependencies typically work. You will call one into a system, that's going to start calling others into a system. Those others may even call third-party dependencies into the system. And so we want to have a clear path and a clear relationship between all of these different components to understand exactly what makes its way into the device. This is also a great way to provide stronger user trust due to a deeper understanding of the product. It can create some distrustful situations when you're trying to conceal information, you aren't providing openness and clarity to users or operators of the product, and they aren't certain about what exactly it is that they're using. Remember, with medical devices, there may be some risk if a user is to take on the operation or to take on treatment from the product. We need to make sure that they are fully aware of any risk that may come up, and they are well educated on exactly what they are using that may affect their health outcomes. Now, a little bit of an obvious benefit is the regulatory compliance and the FDA clearance. It's a requirement to have SBOMs within any medical device that is being submitted to the FDA at this point, unless you're effectively using no code within your product. Having this compliance checkbox and being able to provide assurance to the FDA that you are adhering to their guidelines, adhering to the FDA guidance on cybersecurity, is a great way to ensure a smooth process through your submission without any additional information requests. SBOMs provide a great standardized approach to vulnerability management. Now, when we were talking about these formats, I mentioned that these are not just an industry standard, but across multiple different industries. They're all using SPDX and Cyclone DX SBOMs. There are a lot of existing workflows, tools, and processes to identify vulnerabilities within SBOMs that stem well outside of just the medical device ecosystem. This vulnerability management framework and these processes are a lot more mature than some other newer frameworks might be. So it's a great way to make sure that we have a harmonized approach for managing risks within third-party components and identifying how these are used in our devices. This is also a great way for us to have an easy to track and easy to modify register of everything that's in the code base. It's quite easy to integrate SBOMs as part of your overall development workflow. That is building it out into your CI/CD or continuous integration and continuous deployment infrastructure. Pretty much all the different checks and processes that the code is going through before it is rolled out into fielded products, rolled out into a live environment. Having one of these checks be to generate or update your SBOM based on any changes you're making to the source code is a great way to make sure that there aren't any components that are getting away from you, or if you're making a small change that you weren't aware would affect different components in the system, you're able to track that very easily. It's also a great way to identify if you're running into any issues with the product. Even outside of regularly scheduled updating, you may see that there's a specific functionality that isn't working as intended. You're able to see a quick register of everything that is within that functionality and what risks may be present there. Another great benefit of SBOMs is that legal and software licensing compliance side of the house. Again, this is a little bit outside of the cybersecurity bucket and ultimately comes from the original requirements around SBOMs, understanding how software licenses were used. Very common during the copyleft license days where software licenses may require you to disclose some of your source code. And so in addition to anything we've discussed around cybersecurity, these are still very relevant concerns, and SBOMs are a great way to make sure that you're meeting a lot of the requirements there. All right, now, when we're looking at SBOMs, this is going to extend past the pre-market submission phase and well into the post-market phase. I know this is a constant struggle figuring out how to make sure that cybersecurity is addressed, even for fielded devices that have been out in the wild for a long time. So we want to make sure that we have SBOMs as a continued process, not just a one-off check. Earlier, I was talking about how integrating it into your existing CI/CD infrastructure is a great way to have these automatic checks when you're generating or modifying SBOMs. And so we want to see that these processes carry well out into the post-market management of the product. Now, these supporting processes can be through tooling checks. This can be through a process internally, a review cycle, whatever that might be. Generally, this is going to be most efficient through tooling checks since they can automate a lot of that process, hence why I was talking about some of that integration deployment there. But whatever we're doing, anytime we're making any changes to the product, we want to be sure that that SBOM is fully up to date. This is also going to lean into some of the labeling requirements and the transparency requirements that the FDA has. So it is a requirement that users of the product have access to that SBOM. They also must have access to the latest version of the SBOM. If there are a lot of different SBOM versions floating around, it can be difficult to track down exactly which one is relevant in the current point in time. That's why having a process to continually update and manage these SBOMs is a great way to avoid some of the risks that could come around here. SBOMs are a great way for us to identify any vulnerabilities that may come up even without changing the product. So what we would see in that case is we may have a third-party dependency where we don't change the version of it, we aren't changing the source code, but a security researcher identifies a new vulnerability or a previously existing vulnerability that was not known until this researcher identifies it, and they disclose the vulnerability. This is now likely going to be exploited by other threat actors if they are able to understand how the vulnerability came up. And SBOM tracking and SBOM management is a great way for us to identify that this situation happened. There's a new vulnerability associated with a specific component, and it allows us to prepare a plan for remediating the vulnerability. It's also a great way for us to identify any out-of-date components within the system. Now, I was alluding earlier to some of the additional requirements that the FDA has. They want to see if components in the SBOM are actively supported, and if they are, they want to see when the planned end of support date is. Now, the problem with this is that most open source third-party components do not have a published end of support date. It's very often going to be a passion project or a hobby from the maintainer, and they may choose to just stop maintaining it one day. When we're tracking an SBOM carefully and we're tracking the components within the SBOM carefully, we can set up checks to identify when there are changes to that component. If we see that there's no activity in a certain package for a year, 2 years, that may be the case that it's no longer supported and requires a little bit more proactive research into what is going on. Is there a need for us to replace the component, or should we just monitor it a little bit more carefully in the case there is a vulnerability discovered? Regardless of what the outcome is, it's a clear indication that something needs to be done about that component. At a minimum, there should be some increased monitoring around it. So having an SBOM throughout the entire life cycle of the product allows you as the manufacturer to make more informed decisions on your security posture in the system. Secure SBOMs are also an FDA requirement for legacy devices getting resubmitted to the agency. Now, very recently, in June of this year, the FDA pushed out their guidance, their finalized cybersecurity guidance, with a couple of modifications from the September 2023 version. This was talking about uncontrolled risk in the system, as well as some reduced burden pathways if you are submitting a legacy device without significant cybersecurity changes into the product. A very difficult situation that has come up quite a few times, and the FDA has been trying to find a good control around, is managing legacy devices or devices that were cleared before the cybersecurity guidance was in place. There are hundreds of thousands of them, if not millions, deployed in hospitals around the world. And so how can we try to make sure that we're getting them to a level of security and a level of confidence where we aren't concerned about extremely sensitive risks in the system without needing to effectively redesign existing products, since a lot of these may be very, very old and would not work well with modern cybersecurity compliance. SBOMs are part of this solution in its current state. What the FDA wants to see, if you have a legacy device that you are resubmitting due to, say, a change in your indication for use or a very minor modification that is not affecting cybersecurity, then you can prepare a reduced burden pathway of that cybersecurity documentation. Part of that is going to be your strategy for post-market management, an assessment of uncontrolled risk in the system, uncontrolled meaning there is a potential for patient harm, and finally, the SBOM, as well as any of that supporting documentation around it, and the safety and security risk assessment of each component in the SBOM. So for fielded legacy devices, SBOMs are a great way to help bring them back into the market, allow you to make some changes without the full burden of cybersecurity documentation that is required for new submissions. I know this reduced documentation pathway is still quite new, and so it's something where when we're discussing this with a lot of prospects or clients, they may not even be aware that is an option. This was a change when FDA released eStar version 5.6. We're currently on version 6.0, so made another little change since then, not relating to cybersecurity, but it's a very, very new process. We want to make sure that we're staying up to date with any of those latest and greatest processes available.
Do we want to do we want to cover any like the common tools used for SBOM?
Definitely. So there are a wide range of SBOM management solutions out there. All of them were great for integrating into existing workflows or creating new workflows for the post-market management of devices. Namely, FOSSA is a great tool. It's what we utilize for a lot of our in-house SBOM management tasks. There are some other solutions. Sneak has been a very popular solution that we've seen used in the past. Black Duck has been effective as well. There are also some open source tools. Dependabot is a great tool that comes inherently in GitHub repositories that can track all of the third-party components within a device. Even the native tools, Cyclone DX and SPDX, both have open source tools that you can use to generate SBOMs, to manage SBOMs, to modify SBOMs straight out of the source code. So there are a ton of different effective tools available out there, all at, of course, varying details and varying price points. We like to use FOSSA due to a lot of its ease of reporting and its ease of management of multiple different SBOMs. And so it's a great solution for us, though there are going to be a lot of different pros and cons depending on each tool that you choose.
Cool.
All right. I'd also like to talk about some common SBOM gaps and some common deficiencies or additional information requests that we see come back from the FDA. SBOMs seem to be a very common source of these additional information requests, and so it's very important that we make sure that we have these done well and done correctly the first time. One very common one is that SBOMs did not adhere to the NTIA minimum elements. We may have been missing, say, who created the SBOM, when it was created, some details about specific components. I know when we were talking about those unique identifiers, such as package URLs, those can be really hard to associate with certain packages, especially when you've created them yourselves. So the FDA wants to look into these and make sure that we have coverage for each of these categories across the entire system. Another one would be SBOMs not being presented in a machine-readable format. Now, oftentimes, when especially using some different SBOM management tools, they will print out these easy-to-read reports that would not be accepted by the FDA in form of an SBOM. This is not technically the SBOM itself. This is a report or a wrapper around it so that it is easy to read, generally put out into a PDF or a Word document. The FDA wants to see the actual software bill of materials itself, that JSON or that XML file.
Not an Excel document, which we see a lot of manufacturers try to submit everything on an Excel document, which is not considered machine readable.
It's a little bit of a gray area with the way that eStar submissions work, since they want to see the Excel format, or they want to see Excel, or they want to see PDF. But we generally have to map a XML or JSON SBOM to Excel so that the FDA can ingest it as part of eStar. Though it does cause a little bit of a formatting issue there. And so it's a difficult one to navigate. And, the FDA seems to work with you a little bit. They understand some of the constraints around eStar and that we're still requesting it in that JSON or XML format, but it is a bit of a difficult situation at times. Another very common issue is that the SBOM doesn't cover everything in the medical device. I'll give you a very common situation that we see all the time. We'll have a medical device that connects to a mobile application where you bring your own phone to the system, and then that mobile application calls to different APIs in the cloud for some processing based on what's happening with the medical device. This could be a wearable device, it could be an oxygen pump, it can be a wide range of different products. Now, when we're trying to understand what goes into that medical device, where do we start drawing the line? The mobile application goes into it. Do we draw the line there, or does the phone become part of the medical device? What in the device itself needs to be included? What in the cloud server needs to be included? The short answer for any of these situations that may come up is anything that is a vital component of the system that you control. So for any third-party systems that interoperate with the device, we'll take the phone in that example. You control the mobile app on the phone, but you don't control where the mobile app is running. That phone is not part of your ecosystem and does not need to go into the SBOM. Everything within the application, everything within the device itself, everything within the cloud server does need to go into that SBOM. So making sure you have complete coverage and you aren't missing any areas is vital for this. It may also be the case that SBOMs are missing important components. Now, important components could be identified third-party components referenced in other portions of the submission. The FDA may see that an operating system was mentioned in one area and not mentioned in another. That could raise some flags or some concerns for them. They may see that you only have third-party components, or you only have the source code written by the OEM, but you don't have both of those included in the SBOM. Whatever the case may be, it's a very common situation to see the FDA find discrepancies between other portions of the submission material and the SBOM, and they want to see which one should be treated as the source of truth. It's also a very common situation that SBOM components are missing the support status and level of support. If you remember back to when we were talking about the NTIA minimum elements, these are not within that list, so they can be very easy to miss. These are additional requirements laid out by the FDA that can be difficult to track down due to oftentimes the unavailability of the level of support or that support end of support date for a lot of third-party components. We want to make sure that this is tracked across all different components within the SBOM. All right. I also like to talk about a couple of common misconceptions within SBOMs. Now, it may seem a little bit scary to say, well, you need to create a registry of everything within your device and then disclose it. And that can raise a lot of concern around risk in the system. So we like to talk about some of those points and make sure that they are well addressed. A very common misconception is that SBOMs can provide attackers a roadmap to hack into your device. SBOMs are an effort in transparency and in compliance. If you have an SBOM that is publicly available with enough information for an attacker to use that to compromise your system, that is an indication that you are not doing your due diligence to keep up with security in your product and you are pushing out an unsafe device. You have to be sure to address any vulnerabilities within components in your SBOM, ensure that you are maintaining any of the systems within that SBOM, and that you are not allowing yourself to leave known vulnerabilities within the product. SBOM should just be a register of what components are in place, and if you're able to provide enough information for an attacker to compromise your system, this may also be an indication to users that they are using an unsafe device. So as long as you are doing your due diligence to track and monitor components within the SBOM, address any vulnerabilities that come up, this should not be the case. It is another common misconception that SBOMs could allow competitors to recreate a device by understanding what goes into it. Generally, the secret sauce of any product is going to be the originally developed code from the manufacturer. As a reminder, the SBOM does not include this code itself, it just includes a list of what code is included. So it'll say we have this specific component at this specific version, we have maybe a third-party component, and then maybe a proprietary component that are integrated into the system. But it does not say that we have all of these different bits of code within the SBOM. It's purely referencing out to the different components there. So it should be thought of as a register or a list or maybe an appendix even of the different components, not of the source code itself.
Right. Hey, we have a question that came in. I'll go ahead and display it here. That's a good time to ask it or to answer it here.
So this is saying, while an SBOM is in the cybersecurity portion of the eStar, do you recommend creating an SBOM even if a device containing software or firmware does not contain digital health technology or cybersecurity? In general, SBOMs are a great practice for software development for a wide range of reasons. So we talked about some of the legal and compliance purposes that are very helpful for an SBOM, but we recommend even outside of regulated industries having SBOMs for your product just due to it being a lot easier to track components in your system. It can allow your developers to troubleshoot problems or bugs, vulnerabilities a lot more easily. So there are a ton of advantages with very minimal downside to having SBOMs. It is pretty easy to integrate into your existing CI/CD infrastructure and provides a lot of upside. So we do recommend SBOMs across a wide range of products. Of course, in a lot of industries or in a lot of devices, it's not going to be required. And so if you are not subject to cyber device regulations by the FDA, obviously you don't have to prepare an SBOM, but it's still not a bad idea just for internal uses and internal debugging, as well as vulnerability tracking and management for your internal quality system.
Effectively, it's a best practice.
Yep, exactly. And so we would even recommend it, like I said, just on general projects without the regulated drive, being in the medical space, being in the automotive space. For general tech projects, they can get into massive dependency trees. I know even some personal projects that I've worked on very quickly get up to 400, 500, 600 vulnerabilities from third-party components that I'm integrating into the system. And that lets me know, okay, maybe I should step back, try these different components as well to try to get that down to zero. So
right.
SBOMs are a great way to track risk in your system, regardless of the use case.
Cool.
Now, one other very...
Also, Rochelle.
One other very common misconception that we face is that SBOM should remain consistent throughout the product's lifecycle. These are constantly evolving deliverables. These are constantly evolving items. The SBOMs and the reports generated from SBOMs should evolve as much as the device is evolving. Remember, when we're providing SBOMs to users, these need to be the latest version of the SBOM. And so it is expected that as your device is out in the field, as you're continually iterating your device, you're able to make some changes. Maybe that's to the first party code, maybe that's to the third party code, but you're making changes to the device. The SBOM needs to keep up with all of those changes. So it can't just be a one and done process. We also see that a common misconception, which we can talk about as, we just gave a decent example of that, is that SBOMs would not give actionable insight outside of quick vulnerability identification. It's a great way to understand how your code works together, how different components relate to each other, how they talk to each other, where you're involving different third-party components, be it directly, be it indirectly. It also can talk to your legal compliance, to your licensing. There are a lot of great benefits of having SBOMs integrated into your workflow outside of just vulnerability identification.
Yeah, the licensing you brought up is important because isn't there a situation where if you use certain third-party libraries, you may have to disclose your source code?
Yes, and I will note that this is less common now. Recently, in the past 5 odd years, the prevalence of copyleft licenses, which do require you to disclose your source code, are very, very uncommon. Having said that, the average development time for medical devices is quite long. And so we often see development extending past 7 years for medical products. They're using a lot of old embedded systems where these licenses may be a lot more prevalent. So it is still a very relevant concern in tightly regulated industries where development takes a very long time. Though if you were to work on a new product, build it from the ground up today, it's fairly likely that you would never run into this type of situation where you would be using a license that you're forced to disclose certain components of your source code, since it's not common practice to use them anymore. But once upon a time, not too long ago, it was. And with how long it takes to develop these products, it's still very much a relevant concern for medical devices. Now, this will go right into the final point here, which is that SBOMs are not meant for cybersecurity and should instead be used for compliance. Originally, they were definitely used for that compliance purpose, and they were used for that licensing concern. That's why SBOMs were created in the first place, is to have a track and have a register of how you're using components to be sure that you're legally on solid ground. The use for cybersecurity is a little bit more modern, but it is a great use case for SBOMs. These are meant to be very flexible. These are meant to be a registry of components in your system. There's a lot that you can do with that information. So while both may be true, you can use them for either one, or you can use them for both in combination. All right, now we've covered a lot of ground here, so I want to reiterate some of the key takeaways if you're to take home anything from this talk. The first should be that SBOMs should be provided in all FDA submissions for cyber devices and are a vital component of medical device cybersecurity. It is very common that we'll see an additional information request, an SBOM was not provided, no justification around it was provided, or missing components within it. It's very important to make sure that we're getting this one right the first time. It's a very important area for the FDA, and they drill into it quite frequently. SBOMs must adhere to the NTIA minimum elements and be provided in machine-readable formats. Remember, we talked about SPDX and CycloneDX in XML and JSON. These are the industry best practices, and while machine-readable can be fairly broad, you could consider CSV or comma-separated values as machine-readable as well. We prefer to keep it to these industry-accepted formats. SBOMs are here to provide transparency and confidence to users of the product. Users have a right to know what makes up the device that they're using. They have a right to know if they're exposing themselves to any risk. SBOMs are a great way to do that. SBOMs are a very common source of FDA concerns and feedback. There's a lot that goes into an SBOM, and there's a lot that can go wrong in this process. The FDA is taking it very seriously, and they want to be sure that you are doing your due diligence to cover all of these concerns that we talked about within the SBOM. So make sure that you're going very carefully with this process and you aren't missing any key details. SBOMs boost the security posture of the medical device, and they are not giving up sensitive information to attackers. We know it's a very common concern that providing this information about what goes into the system can provide a roadmap to attackers, but as long as you're doing your due diligence for security, you're staying on top of any vulnerabilities that can come up, you're actively maintaining your system, this should not be the case, and this should only provide more insights and more value to you as the original equipment manufacturer to increase the security posture of your product. Finally, SBOMs can act as a great solution for legal compliance and licensing management. I know our focus has mostly been around cybersecurity, but SBOMs have very broad use cases. There are a lot of different things that we can do with them here, and so we want to make sure that we're using them wherever it can be seen as appropriate. I know we covered a lot of ground, Christian. I wanted to see if you had any additional insights that we can add in here as well.
I think you covered everything like really well. I mean, you are the brain box, as somebody once said in our company. So I'm trying to read the brain box too, but I didn't have my mushroom coffee this morning. So I'm behind
Well,
the
there you
bar
go.
a little bit. Yeah.
I've got my regular coffee getting me going.
And I don't have my cold brew today. I got to go get some. I just got back from Vegas yesterday, or last night.
Well,
Cool.
due
We've
for a
got
shot,
a few more minutes. We'll take some questions. If anyone has a question, we'll hang out here for a few minutes, see if there's any questions that come in. Feel free to ask. Just type it in the box, and we'll share it on the screen here and do our best to answer. I'm still a little bit motion sick from the Wizard of Oz at the Sphere. I don't know if you've seen
Oh
it.
yeah?
Yeah, they kept moving the screen very fast to get blurry, but yeah, it was pretty good though.
I'll have to check it out next time I'm out in Vegas.
Yeah, I like the postcards one better, but Wizard of Oz is pretty good. Cool. It looks like there's no more questions here, so we'll go ahead and wrap up. So thanks again for tuning in to our monthly webinar. We will shortly post what we're going to be talking about in December, and that'll be the last one of the year, I guess, and then we'll move on to 2026. Thanks again, Trevor, as always, for doing a great job discussing complex topics and making them easier to understand for people. All right. Thanks, everyone. See you next time.